Hi, my name is Samara Costco, and I'm currently in my pediatric rotation along with epidemiology and research online. The article that we have chosen to talk about is titled The Significant Effect of Diabetes Duration on Coronary Heart Disease Mortality.
Hello, my name is Sandy Blanco. I am currently taking intermediate med surg along with epidemiology and research online as well. Just a little information about us. Samara and I are actually both currently working at UCLA Medical Center in Santa Monica as care partners in the float pool. We really think this is a really good experience because we float to different floors and then, we will be able to pick our unit of choice so we will know where we want to go as soon as we graduate. I personally have become very passionate about the emergency room, and I hope that one day I will be an amazing ER nurse. And I definitely do want to continue my education as a trauma nurse practitioner, but I'm taking this one step at a time. So, why did the scientists perform this study? This study forms part of a larger study called the Framingham Heart Study to figure out what is the major leading cause of cardiovascular disease. According to our article, the risk of coronary heart disease in patients who have diabetes mellitus type 2 is about 2 to 3 times higher than the average individual. Coronary artery disease is a type of blood vessel disorder included in the general category of atherosclerosis, which is also known as the hardening of the arteries, or plaque buildup, in other words. The hypothesis of this study is that the duration of diabetes is an important predictor of incidence of coronary or heart disease among people with diabetes.
What were the major techniques used in the study? Before I go into the major techniques, I wanted to tell a little bit of history about the study. So the Framingham heart disease study, it started in 1948, and during this time, there was not a lot of information on cardiovascular disease or strokes or diabetes. And this was, at the time, this was the leading cause of death. It still is, but at the time, it was more prevalent. So, due to this, the objective of the study was to find out common factors that contribute to cardiovascular disease. So this study is just one of many series of studies that were conducted to establish information of decreasing the death rates of cardiovascular disease. So that being said, back to the techniques. The subjects of the study were from the original Framingham Heart Study. So to be included in the study, the patients must have laboratory work and physical assessments. The patients must have had diabetes or cardiovascular disease to be included in the study. The participants were followed throughout a 12-year course of their health outcome. So that included any hospital visits or any cardiovascular events. What were the major results? Did they support or negate the hypothesis? And do they point to future or further studies? So the results of the study were 588 participants, with 329 being men and 259 being women with diabetes, and a duration of 7.7 years. Out of these subjects, there was an incident of cardiovascular disease in 193 of them, which included 55 deaths during the research. According to the research, the risk of cardiovascular disease increased by 1.23 times higher for each 10 years increase of duration of diabetes. The research later discusses that the results did not change with age and sex. The results coincided with the hypothesis because of the people with diabetes during a 12-year period increased their chances of developing cardiovascular disease and unfortunately increased their risk of mortality. The conclusion of the article was that for each decade the participants had diabetes, there was an 86% chance risk of cardiovascular disease death. These results noted that the participants with diabetes deaths were concluded due to a myocardial infarct than with participants without diabetes. The results included that through a coronary artery bypass exam, a greater survival death rate of those of diabetes. And also, the study found that that some stuff couldn't really go into the study because the study was done a long time ago and over a course of time. So things like diabetes at the time weren't so prevalent, so they didn't really know how to diagnose it.
Okay, and just to, in addition to what Samara said, the original study was done back in 1948, and they had, I believe, about over 2,000 participants, in which there was absolutely no baseline glucose level. Therefore, anybody that had type 2 diabetes mellitus automatically became part of the study. When this recent study was done, they actually had more strict criteria and baseline glucose levels, so not everybody was with type 2 diabetes accepted into this study. So as I'm pretty sure I mentioned and Samara has mentioned, cardiovascular disease is the #1 cause of death worldwide, which is pretty absurd because engaging in the proper exercise regimen as well as healthy eating can prevent this. The reason why I chose this article is because I have a history of diabetes and hypertension. My father currently suffers from hypertension, and it is extremely worrisome to me because he eats extremely unhealthy. With the family history of diabetes and my father having hypertension, pretty much anything can happen. My father also has a history of gallbladder disease. He had a cholecystectomy about 10 years ago due to gangrene. By knowing all of this, if he continues to eat unhealthy, he will end up with coronary artery disease, despite all the times I have told him to eat healthier. The article was very interesting to both Samara and I. We believe it was very clearly written with a lot of information regarding the topic. When it came to breaking down the results for the survey, it was a bit difficult, but with time and then more paying attention more, we were able to dissect the results.
So the reason why I chose the article is because my mom currently suffers from coronary artery disease, and she, like most, doesn't follow her medication regimen. She doesn't listen to what the doctor tells her, take your medicine, eat healthy, exercise. And these are all things that can be prevented, and it's very, worrisome, like you said, because you want so much for your parents to do good, and they just don't listen. So this article is interesting to me because she also has diabetes and hypertension. And also my sister, who's 30 years old, suffers from diabetes and hypertension as well. And she also doesn't listen. And also she had a cholecystectomy also. So these are the reasons why this article was interesting to me. So hope you guys liked it.
Thank you.
Thank you.